Leaving here, being on the deserted roads or seeing people queuing outside the supermarket was just probably what made me more anxious. But actually coming in here and seeing that there was a piece of normality that was still continuing, that it very much was business as usual.
One of the challenges of COVID-19 outbreak was definitely the suspension of our face-to-face clinical work. And this brought as a consequence really try to adapt and develop and explore new ways of working and providing our care to clients, staff, family and carers. And this definitely has been a massive challenge.
3 members of my nursing team were redeployed to the wards. There was certainly some anxiety about that. 2 of them in particular hadn't worked on a ward for, I think, nearly 20 years. So they were anxious about sort of embracing ward work, but they had an induction period. So they were able to settle down, they were able to observe, they were able to see what was happening, what was going on, and how they could embrace the ward work.
I think it's about lots of staff just thinking of the patients as their families.
I normally would like to see them happy, and with them being happy, I am happy, and the rest of the staff are happy.
I think what was quite obvious was the suddenly change in attire. We don't normally wear scrubs, facial masks, head coverings, and I think that would have been the most significant change, I would say, particularly for the patients.
Most of them had a diagnosis of dementia, so it was quite difficult for them to understand why we had to do it, even though we have to continuously explain that we are doing this so that we can protect them.
I think the most difficult part for all of the patients was when we had to make the decision to close the ward off to visitors. One way around that has been to facilitate telephone calls, but what has been absolutely fantastic has been iPads, so that we can actually enable face-to-face Skype type of meetings with friends and families, which has been both reassuring for not only the patients but also families as well.
For carers, I think it's been a big adjustment for them not being able to come and visit. When I came here, I kind of wanted to make sure that I got in touch with all the families, just to let them know what changes have happened. The Skype calls have worked really well, which has been really nice to see, especially with patients whose perhaps English isn't their first language. So them getting that opportunity to communicate with, you know, their loved one in the language that they speak, that's been lovely to see.
For us as the receiving ward, we found it quite helpful to have the other teams coming to support us, but I think for them must have been quite a challenge, being redeployed to a ward that they haven't worked before and having to adjust. But we all work together as a team.
3 weeks that I've been here, I've learned actually a lot. I feel like every day you're going to be learning something new. With this placement with the elderly and with the whole coronavirus, we do monitor a lot of the physical health, we're monitoring it regularly. You spend a lot of time with the HCAs instead of the nurses. You get to know the patients a lot more, they know the in and outs of the patients.
I've learned a lot of skills around infection control. It's helped me actually as a person in terms of my own practice.
I was particularly amazed just how everyone just took it all in their stride. So yes, the anxiety was there, the anxiety of the unknown, but everyone just kept going, and more than anything, it felt okay.
Even during our day-to-day work, we try anyway to still maintain that, you know, that little bit of normality and little bit of, you know, work routine, like calling each other and supporting each other. And so that sense of, I think, humanity and solidarity, just stay together. We are all together in this.